I'm going to turn things over to Senator Murray.
Well, thank you so much to all of you for joining me today for this really important conversation. Because right now, Republicans are doing everything they can to distract from and ignore the healthcare crisis that is inching closer every single day. But no matter how far they stick their heads in the sand, it is not going to change the fact that healthcare tax credits that millions of families rely on to afford their coverage are about to disappear. It won't change the fact that right now insurance companies are finalizing massive premium hikes for next year. And it won't change the fact that states are going to be sending out notices of eye-popping price hikes to families across the country in the coming days and weeks. That is going to be so devastating. Some of the biggest healthcare price increases for families in our nation's history. On average, families who lose these tax credits are going to see their monthly premiums more than double. Some people will see their premium costs triple, even quadruple. For many people, premiums will jump by over $1,000 a month. There are going to be millions of people who simply will not be able to stay insured, including an estimated 80,000 people in Washington state. In fact, there's a new poll this week that found out that 7 out of 10 families would not be able to afford their coverage if premiums double, and 4 in 10 would likely just go uninsured. That is the reality Republicans are now refusing to address. And if Republicans continue this refusal to act, it will mean people across America skip their basic health care or skimp on prescriptions or miss out on life-saving treatments. This was completely avoidable. It is completely avoidable, but only if Republican leaders stop sitting on their hands and start sitting at the negotiating table. However, right now, they are refusing to budge. So far, all they will say is later, as if we haven't been asking them for months to work with us to address this, as if we weren't already at the midnight hour. Seriously, open enrollment in Idaho starts next week. Republican leaders are so determined to dodge this issue, they would rather shut down the government than work on solutions. But Republicans should know they can shut down the government, but they cannot shut down debate. And they can't shut out the voices of families who are so worried about these skyrocketing healthcare costs. And that's what conversations like this are about. If Republican leaders don't want to talk with Democrats about opening the government and stopping premiums from doubling, well, we're going to talk to the American people about what is at stake. We're going to lift up the voices of families who are worried that their premiums will double. We're going to lift up the voices of patients who are worried they won't be able to afford the care they need. We're going to lift up the voices of people worried they won't be able to fill their prescription. And we will have the conversations Republicans are trying to avoid. Make your voices heard in the Hall of Congress and fight tooth and nail to address this healthcare crisis Republicans caused. With that in mind, I want to turn it over to Rebecca. She's a small business owner from Seattle who can share her story of what that ACA tax credit means for her family. Thank you, Rebecca.
Thank you, Senator Murray. Hi, I'm Rebecca Staffel. I live in Seattle. And yes, my husband and I are both entrepreneurs. He owned a small bicycle shop for the last 17 years. I'm a freelance project manager, film producer, and our income rises and falls seasonally. Without being able to buy insurance on the exchange and receive the extended premium tax credits, we would not be able to do either of these jobs at all. Our shop provided jobs to 5 more Washingtonians and paid plenty of B&O taxes. I left the corporate world to go out on my own and try consulting and freelancing, which gives me the flexibility to be available to my aging parents and also to our 20-something daughter as she launches into her own adult life. If we didn't have the possibility of getting individual coverage on the exchange, we would not be able to create jobs, pay those taxes, or be available to our family. The tax credits make coverage affordable for us. Because our income fluctuates, we are grateful that we have a steady, lower monthly payment. It's dependable, we know what it's going to be. And having health coverage means that we're staying on top of our preventive care and we're avoiding costly illness. Um, I'm reading a statement, but this is absolutely true. I am terrified about the loss of the extended premium tax credits. I've been watching this since it came up in the spring very carefully, and I'm pretty freaked out. My estimate is that our payments will increase more than $1,300 a month, increase $1,300 a month for our current bronze plan coverage. And that's before any increases in premiums. So honestly, I have not even had the stomach to go look and see what the true cost will be next year. Um, so it feels crazy to spend $22,000 a year just for a bronze plan where we can see the doctor once, get a couple of screenings, and even with that, still have copays. So the loss of those tax credits means that either we're going to have to look for a super basic catastrophic plan, or it's possible that we will opt to go without and hope for the best. $22,000 is a lot of money. And so we are going to make sure that we have our final appointments with our doctors in the next month or so with this assumption in mind. Um, I feel that this situation it's devastating, but it's also anti-small business. And that's what really disturbs me. It makes no sense in a country where we say we value innovation and entrepreneurs. We need to support people who want to go out on their own with this chance to have the health exchange and the extended premium credits. With that, I'm going to hand my virtual mic over to my fellow entrepreneur, Jason Lord Johnson.
Thanks, Rebecca. I was gainfully employed by a local longtime business until last year when I was laid off. And since then, I have started my own video production business. And my wife's always been a contractor. We relied on my health insurance through my previous job and then Cobra coverage until we just went on the exchange in August. And we found that the premiums we're paying are more than, for less coverage, are more than what we were paying when I had my actual job. And the idea that I've looked into the numbers and they will more than double if this tax credit is removed. And it ends up being almost 60% of our mortgage payment every month. And it's unbelievable that in the face of this and how it'll affect Americans. And honestly, I feel fortunate. My wife and I are employed. We do have a means of making money, and this will be a burden on us. And there are so many more millions and millions of Americans across the country that are going to be even more negatively impacted by this than we are. And it will be a struggle for us. As Rebecca said, we've considered going to just a catastrophic version of insurance, because then if we have to pay that 22,000 plus dollars annually, will it cost us less to just have catastrophic and pay out of pocket for things? That's a scary place to be. The system is definitely broken, and it's infuriating that this administration and the Republicans in Congress think that it's more important to extend and give more tax breaks to the wealthy on the backs and the health of tax-paying Americans who are just working to get by and participate in their democracy. It's infuriating. I don't believe their rhetoric. I am just very angry and frustrated by the fact that it has come to this point, and I applaud efforts to try to do something about it. Yeah, that's all I have, Senator.
Thank you. Thank you to both of you. I mean, I've heard this story from many people. The two people with us today, small business owners, are saying to me what a lot of small business owners are, that they're trying to provide healthcare for themselves and their families. And this tax credit, if it's not extended, means not only will they lose it, but so will their employees. Naomi,
Great.
you want to take some questions?
Yep, we have time for questions from any members of the media in attendance who'd like to ask a question. Just use the raise hand function and I will call on you. So I'll give folks a minute to get their hands up. All right, not seeing any hands raised. I will also give folks an opportunity if you want to unmute yourself to ask a question. That is also great.
Hi there, can you hear me?
Yes, we can.
And I'm sorry, I am not seeing the hand raise function on my side, and that's probably a me problem, even though I should know how to use Zoom by now. Thank you for being here today. I think a lot of people want to know how long are you and your colleagues willing to go with this shutdown to fight for this key issue?
Look, this can end today if Republicans just come across and negotiate with us. What is stunning to me is this problem is out there. It's real. We've been telling everybody for months this is going to be on us. And now Republican leaders won't even pick up the phone or walk across the aisle or work with our Democratic leader to find a solution to this. It can end today. How long it goes depends on how long Trump and Thune and Johnson decide that they're just going to cross their arms and let this crisis occur.
Great. And we have time for one or two more questions. If there are any other questions from the audience, feel free to raise your hand or unmute yourself. All right, last call for any questions. And not seeing any hands raised, I will go ahead and turn it to, oh, okay, I see one question from in the chat from the Northwest Progressive Institute. And it says, does Johnson's refusal to call the House into session say something to you?
It says a million words to me. Speaker Johnson has told his members, all the members of Congress in the House, to go home and take a vacation. At a time when our country's in crisis, this is their response. That is cruel, and there's no way to understand it. Speaker Johnson needs to bring his people back. President Trump and Republican leaders need to use their negotiating tools that they are supposed to have when they are leaders in our country and come to the table to solve a crisis that is in front of this country. We're here, I'm at work, we're ready to go, make the call.
I do have one more question. I was just wondering what the conversations have been like with other members, your colleague Maria Cantwell, as well as the congressional delegation in the House of Representatives of Washington. We only have two Republicans from Washington State representing Washington in Congress. Have you or any other Democrats spoken to them to try to make any headway?
Well, the two House members are home on vacation, so they're not here. So that is challenging. If they were here, I would say to them, in your congressional districts, you have the most people per capita who rely on tax credits and Medicaid who are going to be suffering. It is your families, it is your hospitals, it is your providers, it is your communities that are going to be hurt if this isn't solved. Talk to your leader and tell him to work and get this fixed.
Thank you, Senator.
Great. Last call for any other questions. I'm not seeing any hands raised. And so I'll turn it over to Senator Murray to close us out.
Yeah, thank you. And I really appreciate everybody being on this. And I think it's really important for everybody to understand that the crisis we are talking right now about people getting in the mail their costs increase that have the ACA tax credit is imminent. But this will infect everybody. If people like you just heard from don't get their health care or they buy a Cadillac plan that doesn't cover what they need, they will become part of the people in this country that are uncompensated care. If there's an emergency, they go to the emergency room, they go to the hospital. Everyone's costs will increase if we do not solve this problem. That's why we're here. That's why we're at work. That's why we're saying, President Trump, come to us. Let's work this out. It's critical.